Now, I mentioned earlier this morning that measles cases are continuing to climb, with 17 cases now confirmed and health teams racing to track thousands of close contacts. Health New Zealand says many of the cases have been linked, but warns there is still a very real risk of a wider spread. So with an update, with us is Dr. Matthew Reid, Public Health Medicine Specialist at Health New Zealand. Kia ora, good morning to you.
Good morning, Nadine.
How concerned are you? I feel quite concerned, but I'd like someone in the know to tell me whether I should be concerned.
Yeah, we are concerned. Measles is a worrying condition. We don't have the vaccination rates that we need in the country to protect us from a potentially large outbreak. That's why we're putting all that effort into contact tracing and increasing immunisation rates.
But given how infectious it is, are those methods, those measures, going to be enough to contain the spread?
Contact tracing is what we have without being, more disruptive. We want life to be able to go on as usual. And so we're identifying people that are exposed, rapidly getting in contact with them using whatever means we can. We work with the places where exposure happens, try to work out everybody who's been exposed, get in contact with them, and make sure that they are supported to stay in quarantine, to protect other people. And we're doing that. We've increased the capacity of our contact tracing to do that.
It sounds like you're doing what you can. I guess what I'm asking is, will that be enough? And given that last time, a third of cases ended up in hospital, and we know the health system is under strain, can we handle that?
That would be, it's a good question about the health system and how prepared it is for that. Measles is a well-known old disease. It can make people really sick. For younger children, it is particularly bad. Also, pregnant women and immunosuppressed people, people without strong immunity. Yeah. So this week we're running the immunisation week. We really want as many people as possible to get vaccinated, and that's why we're going ahead today, and it's being launched today.
Yeah, and I guess if more people had been vaccinated in the first place, we wouldn't be in this position. Thank you for your time this morning. Dr. Matthew Reid, Public Health Medicine Specialist at Health New Zealand. And as he mentioned, though, the young are the most vulnerable, so if you can be vaccinated, please do. Coming up, we are going to be talking to former All Black Ian Jones, who's going to break down that win over Ireland and that late surge. We'll be back right after this.
Oh, no lemming